Every single day I see patients in my office, and roughly 1 in 5 cases, I'll say, you know what, you don't need surgery. And the reasons vary, but there are a few that stick out in my mind quite dramatically. Frequently, they're older patients. When you sit down and talk to them about their symptoms, they're just not severe enough for you to want to take a knife and open their chest bone. And so if you look at their data, their echocardiograms, their catheterizations, their reports from the doctors, and you put it all together, looking at the whole patient, you say to yourself, you know, if that was my mom, I don't think I'd take her to surgery. And that's the litmus test, right? If it was a relative of yours that you love dearly, would you subject them to major interventions? And that's one of the major reasons that we say, no, it's not time yet, or don't do it at all. Now, one of the things that I think NewYork-Presbyterian offers that really is unique is superb diagnostic tools. You know, folks always come to me for an operation, and I caution them, you're not here for an operation, you're here for an opinion. And for me to give you an opinion about what you really need, which may be, by the way, and it is oftentimes, don't have surgery, you're not ready yet. I've got to have the best tools to figure out where you are on that spectrum of maybe needing surgery. And you need to have tools to decide that. Those tools sometimes come in the forms of high-tech machines that just aren't present in a lot of hospitals. Now, a lot of folks are reticent to get second opinions because they say, you know, it's just a minor procedure. Well, I tell you, a minor procedure is a procedure in somebody else. If someone's going to touch your body in any meaningful way, you better get additional thoughts on that. You would if you were buying a car. If you're buying a kitchen appliance, why wouldn't you do the same thing for your own body, the most precious thing you've ever inherited? I had the honor of writing one of the big textbooks on minimally invasive heart surgery. And I had to, in the very beginning of the book, define what that meant to me. And for me, minimally invasive means quality of life surgery. That's what it's all about. It's about doing the exact same operation that I would have done with a more invasive approach. So you get the same result down the road, but doing it in a less invasive manner so that you can't tell I was there. I do feel that our ability to tie together 2 of the best universities in the land, together with a major institution that provides the healing services of NewYork-Presbyterian, gives us a quantum leap beyond many of the other facilities that do a great job day in and day out, but aren't necessarily changing the face of medicine. And especially if someone is going to do something that might change your life for good, I'd rather be in a place that has all the options available.